Hello again, it's Dr. Ade. So we started discussing BPH and I was going to come back, and I am coming back, to discuss the significance of some of the symptoms and the possible complications we can get and why it's important that you seek help sooner rather than later. So we said there is the possibility that the urine isn't coming out as it should. So we've got, once it gets past the compression, we get poor flow because the prostate is enlarged and is pressing on the tube that leads from the bladder to the outside. Now, then we get the symptoms that we discussed, which is a dribbling and poor flow. Now, having said that, so if it's not coming out, what's happening to the urine? Essentially, it's collecting in your bladder. It's not circulating. So you have a backflow of urine in your bladder. And what that does is, because it doesn't cause pain initially, it gets more and more. So the liters in your bladder gets more and more. And it then starts to backflow up into the kidneys. So there's a reason that we prefer circulation of urine out of the system, and then you drink water and it replaces it. So it's a constant circulation. When that's disrupted by BPH, what tends to happen is we have a backflow. Now, unfortunately, because we don't have circulation, that can lead to water infections. And water infections in the elderly, which is when we have these symptoms, can lead to further complications which spread through the body and eventually can cause what we call septicemia. So it is not uncommon for what started as a plain uncomplicated enlarged prostate to lead to septicemia and mortality. So we do need to be aware of these symptoms and know when to step in. So if you start noticing that you're having dribbling, you're getting up to wee day and night, you are having a poor flow, you're having a feeling of incomplete voiding, occasionally sometimes you're having bleeding, you don't necessarily have to have pain. Don't wait for the pain. By the time you're getting pain, you're probably in what we call urinary retention, or you've got a water infection. So don't wait for pain. Don't wait for blood. So it's easily treated. I say easily treated. That is a loose word. There are various ways to treat it, and I'll discuss that in the next short. Thank you very much. Thank you.